hospital is here to support all your breastfeeding needs. We're all World Breastfeeding Week, so happy World Breastfeeding Week. Lactation Consultant. I've been working with new families. World Breastfeeding Week, so happy World Breastfeeding Week. Lactation Consultant. I've been working with new families for about 25 years of my career. I'm also the proud mom of 3 Hoag babies myself. So we're going to talk about the benefits. If you've seen any of our other breastfeeding videos, in one of those we talked briefly about some benefits, but of course we didn't list all of them. Even here today, we can't possibly list every single benefit because there are so many benefits, and not just to moms, not just to babies, and so we're going to touch on a few of those. So welcome to the benefits. The great thing, we don't have to worry about contaminated water, contaminated powdered formulas, things like that. So it's ready for them when they want it. It's easily digested and absorbed. It passes very quickly. So we say about their system, especially after birth, in cleaning out all those things that they got in utero, which can help lead to less jaundice also. It completely coats their digestive tract. It changes every single day. So breast milk for a 1-day-old baby is different than a 1-month-old baby, a 1-year-old baby, depending on what mom's introduced to. She's introduced to viruses, bacteria with us of, oh my gosh, we do have a world full of viruses and bacteria and things. And whatever she's introduced to, it helps protect her baby from that. What a great thing that does. So it does meet all their needs. We see less obesity with children who are breastfed or suck. So if a baby wants milk, they suck one way. If they just want to pacify, they suck another way. Remember that overeating is a learned behavior. So we have to learn how to overeat, and babies aren't born wanting to do that. So they suck one way to get their meal, to get their food. They suck a different way when they're just pacifying. And so watching our videos that we have in Hoag Health archived, go ahead and look at the breastfeeding video, and we're going to show you the difference between how to tell when a baby is sucking to get milk or not. So you can learn those subtle differences with your baby. Babies who are breastfed, we see less incidences of childhood diseases, such as diabetes, asthma, ear infections. And ear infections, lots of money spent in our healthcare system for children with ear infections. So babies who breastfeed, we see less ear infection with those children. Diseases like Crohn's disease, urinary tract infections, allergies, respiratory illnesses, all those are reduced with a baby who breastfeeds. Less cavities with breastfed children. It seems, wow, so many different avenues and different ways that it protects your baby with that. We see less diarrhea and less constipation with breastfed babies. Less illnesses, which equals less hospitalizations. So it's really stressful to have your baby hospitalized. So breastfeeding decreases the risk of that baby being hospitalized. Less rates of infant mortality or infant death, and less incidence of SIDS, which is sudden infant death syndrome. So for me, I can't think of a better reason to breastfeed than protecting the life of my child. Breastfed babies actually have better vision through that. So breast milk, remember, is more than just feeding. It's protecting. Now, what about my preemies? Breast milk is important for every baby, but especially for those preemies, those babies born, before 37 weeks. And we worry a little bit more about them. Well, breast milk protects them for diseases. You have it. But for a preemie, they're so much more susceptible. From the bottle or a feeding tube if they need that first, or right from mom's breast when mom comes in to visit that baby if that baby's in our. So those are some of the things that why we would breastfeed a baby and how that baby is protected. But for my moms out there, there's also benefits to you, of course. We see less postpartum hemorrhages, and what that means is all your nurses and doctors are watching you for excessive bleeding after the birth of your baby. Well, when you put a baby to the breast and you're breastfeeding or pumping, if for some reason that baby's not breastfeeding, like we talked about that preemie who might be in our NICU, our intensive care unit, we get them on pumping. that causes that uterus to contract. And when your uterus contracts, you bleed less. So we're all breathing a sigh of a good thing. It boosts your oxytocin. So oxytocin is something you hear about. It works with, you'll hear people call about the letdown, and people will say to me all the time, what's a letdown? It just means the milk coming out for the baby. And oxytocin is what causes that, or lets that milk come down and lets that milk flow. Oxytocin also is a very calming, it calms new moms, and that's a good, it's the oxytocin. And that's nature's way of telling you, you need to sit and relax, you need to rest, you need to let your body heal from going through that 9 months of pregnancy and the delivery and your recovery. You've got to catch those naps when you can. Less type 2 diabetes, and that's a chronic disease. Perimenopausal cancers such as breast and ovarian cancers, so moms who breastfeed. Now, when we talk about benefits to moms and babies, to everything, look, my philosophy is one day is better than nothing. One time of a baby getting breast milk is better than nothing. But it compounds over time. So if a mom breastfeeds 3 children and she breastfeeds them, for whatever length of time, of course, is going to have more protection than a mom who fed for a month. But every time you breastfeed or make milk, you're protecting, or it's good for baby and for mom also. You lose weight faster. And that is a true thing. People will say to me, is that a real thing? Yep, you burn up to about 500 calories a day just by the process of making milk and delivering it to your baby. I always say it's the best gym membership you'll ever have right there. I don't know. The elliptical or breastfeeding, I would take the breastfeeding any day for sure with that. Moms who breastfeed have less anemia, less postpartum depression, which is a real thing, especially in this time of COVID. And being home in our lives just turned upside down. So breastfeeding helps that. And it goes back to that oxytocin and calming moms down. So that's a good thing for moms. Breastfeeding's easier. Now, that said, moms sometimes will say to me, wow, this is kind of hard. I thought this was natural. And I always tell her it's the most natural thing in the world. But it doesn't mean that there's not a learning curve to it. But once you settle in, think of riding a bike, think of learning to dance, think of any job you've ever had. The beginning is always tough, and then you learn how to do it and you barely have to think about it, like riding that bike. So once you settle into the routine, it is so much easier. You pick up that baby, the baby also has had time to practice what they're doing. Your baby knows how to suck. They have a suck reflex, but it doesn't mean they always do what they're supposed to do. So they need time also with that. It saves money. No buying formula, no buying bottles. Eventually, if you want to give your baby a bottle, then yes, of course, you're going to pump milk and put it in there, or give formula, whatever works in your lifestyle, or what you have. Because sometimes mom's job, she'll tell me I can't do that or do this, and do you have to give it up 100%? No, you don't. You can breastfeed 2 times a day, and you'll make milk for 2 times a day. Versus I'm making milk for twins who are feeding 10 times a day, then yes, I'm going to make milk for that. And then we work you through gradually weaning down. But you never have to give it up completely. But no buying formulas, that's really expensive. You can pay between $1,600 to $5,000 a year buying formula, and that depends on the type of formula that baby might be getting. So huge savings there. And I say, buy formula or a trip to Maui. I'm taking the trip to Maui hands down every time. So if there's partners out there, mom is breastfeeding, you thank her for doing that. What a great thing for that baby, but also saving money, and perhaps put that into that piggy bank, and maybe also, especially if you're going to maybe countries where water sources are a little iffy. Breastfeeding is right there. You're not having to mix for always the perfect temperature. So that's a little bit about moms and babies and how it protects. But what about other things? The environment. The environment, so much of what we're talking about is the environment now, and being green. And it is being green to breastfeed because there is less waste. We're not having the packaging with that. We're also reducing water usage. So the statistic is it takes about 1,200 gallons of water to make 35 ounces of formula. So that's a lot, 1,200 gallons. there, and it's perfect. So it also protects babies in natural disasters. You know, we're coming into hurricane season, and that was no more apparent to us than during Katrina, when they couldn't get formulas into many of the hardest hit areas. And what women were doing was, getting out breast pumps, giving it to neighbors. The government brought in breast pumps as soon as they could to even get moms to try to relactate, or with other moms, to keep pumping, because it was hard to get the formula in there. So definitely something to think about with that environment. Just society in general. And we tend not to go there. We tend to be very specific on it. It's just UNICEF says that statistics, 1.90% of our population, other things, and not having sick children, and that would be nice too. We see lower health care costs with children who are breastfed, and a big part of it is what I talked about before, and that's a good thing. Fewer sick babies, fewer hospitalizations, fewer prescriptions we're having to buy, which saves so much money in that, which is amazing. For me, it's just the point of the stress of having that baby in a hospital, which would be so stressful. So lots of things: moms, babies, environment, society. Like I said, I'm not listing every single one because we would be here for a lot longer, but so many good reasons. So when you're choosing to breastfeed, we know through statistics that a woman who chooses to breastfeed before she delivers has greater success in breastfeeding than the woman who doesn't. So good for you, and I hope that I've helped you in saying, wow, yeah, those are great reasons to breastfeed. Not to mention you get to hold your baby so many times a day, and that's the best thing ever. That's my favorite thing to do in life, is hold a baby. While I have you here, I want to briefly talk about some California laws protecting you. You're working from home, but not everyone. But you are guaranteed break times to express your breast milk. Now, they don't have to give you extra on top of what's allowed on your job. So basically the 2 10 minutes for an 8-hour shift, 2 10-minute breaks plus that 30-minute lunch. But they also have to give you a place to pump, and it has to be somewhere other than a bathroom. So start looking into your companies. And companies have gotten so great with this, because I hear it from you guys of telling me, my company has even rented a pump, and it's a closed system, so we just bring our parts in and we can pump and things, because I'm holding out hope that we will be back in and together and, being able to actually pump from work again, while maybe still working from home. But right now we're working from home, we're being safe with that. There's monetary penalties for companies who don't do these things. So check with your HR department, check and see what they're giving you, or what they're providing you. They have to give you a place to store your milk. Now that could be a cooler with ice, but they have to give you a place for that also. You are protected from breastfeeding in public. So it is not against the law in the state of California to breastfeed in public. You cannot be asked to leave a public place because you are choosing to breastfeed your baby. So those are your rights as a Californian. Womenshealth.org is a great site to go on. I also encourage you to have your companies do that. They can find, there's all kinds of facts and figures that show how they are protected or how they benefit from helping and supporting a woman who chooses to pump her breast milk while she's at work. What statistics show is that for every $1 they spend, they save $3. So that will get your CFOs and your accountants and that department saying, yeah, we really do want to support this. Of course, we want to support it because it's the right thing to do, but also they see that they do save money doing that. So those are California laws. I encourage you to also look up ones, if you are watching us from not California in your state, that womenshealth.gov is a great site. On this live stream, there's going to be lists of references, also our baby line number. So here at Hoag, like I said from the beginning, we are here to support you on this journey. Like I said, I thank you for having a baby feed. So we're here to support you. All of our staff is trained in lactation. From the nurses who deliver your baby to the nurses who take care of you and your baby afterwards. If your baby's in our intensive care unit, our NICU, those nurses are trained in lactation. There's one of me. I work in what's called OB education. And OB education, you might see me walk into your room to help you with breastfeeding. But remember, all of our staff is trained in lactation. You don't necessarily have to see the lactation consultant. I always say it's a really good thing if you don't see me, although I want to see you because now I'm seeing all the time, oh, you're the YouTube lady, which is really fun for me to then see you. So hopefully I'll recognize you when I see you there. But it's you don't need to see me. Usually that means something's going on with that baby, and most of you will do just great. But the nurses are there to support you. My department's there to support you. So one of me is there every day on that 7th floor, which is where you are with the baby after you've delivered. We have a breastfeeding clinic here to support you once you've gone home. During COVID, we have cut back on appointments as far as streamlining them so that we're not having patients overlap. So it's safe for you to come in and see us. We weigh your baby. You feed the baby, we weigh the baby again. I'll tell you what that baby gets. We work with latch. Sometimes breastfeeding is going great and mom says, can you look at the umbilical cord? Absolutely, we're registered nurses and we can do that too. We have the baby line. The number's going to be listed here for you. Baby line is a helpline that you can call with any questions you have about anything, whether it's your pregnancy, your delivery, after your delivery, mom, your recovery, breastfeeding, the umbilical cord, a rash, I'm going back to work, what do I do now? Please call us. We're here for you. There's not a limit. You can call us 10 times a day if you want to. Just to share a secret between us, I called Baby Line. I actually cried on Baby Line because I wasn't doing this when I had my kids, and they were so helpful and so encouraging. And that's why I also feel so fortunate that I do this at Hoag, the very place where I called with my own children. So know that we're out there for you. If you have tested positive during COVID or with delivery and that baby, remember that the CDC is still recommending that you do breastfeed. Of course, wear a mask, wash your hands. As I say 4 million times a day, wash your hands, wash your hands, wash your hands. But those are CDC guidelines, so we are here to protect you. So hopefully this helped give you some information on the benefits of breastfeeding as we celebrate World Breastfeeding Week. So you know what? Celebrate tonight. Do something fun in your house safely and celebrate.
The question is, I am 35 weeks. Is there anything moms can do pre-birth to promote breastfeeding? I have heard moms express in the last month of pregnancy to ensure the baby gets breast milk and not formula.
Okay, so there was a question from a mom who's 35 weeks pregnant asking about, is there anything she can do before she comes to the hospital? She's heard about possibly expressing breast milk. I never want you to do anything without checking with your OB. I don't want to, because sometimes nipple stimulation can actually put you into preterm labor, so we don't want to do that. So I want you to check with your doctor with that. But the things you can do is exactly what you're doing. You're on here now, you're educating yourself, because remember I said education is powerful, and education, we see moms being more successful. So check with your OB about that, and that's where we'll go for that because of preterm labor. Anything else? Okay, so if you do have questions that do come up, just call us on the baby line. There's someone there, to answer questions. Most of the time you have to leave a message